Primary cough headache. So headache, it's a complaint, it's not a disease. So headache, the complaint of the patient, you can have in simple conditions like upper respiratory tract infection, and even in dreaded conditions like you have brain related tumors. So that's a general complaint of the patient. So if it is cough related, it is called cough related headache, and in that you have two types. You have primary and secondary. I'm talking about the cough now, the primary cough and the secondary reason. So primary cough, because you don't have any reason related to that, and the patient just coughs without any sputum coming out. There is no expectorant. It's dry cough. Secondary cough, he has got a reason for it. Maybe it's upper respiratory tract infection, or maybe any pus discharge behind the nose irritating the throat, or maybe it is tonsillitis, pharyngitis, bronchitis, tuberculosis of the chest, and I can keep on naming so many conditions where you have cough. So these are the secondary causes of headache. So in this video, I am going to talk headache which is related to primary cause where there is no known reason for the cough. So what produces the cough? So what happens is, whenever the patient coughs, what happens is there will be raised intracranial pressure. So this results in irritation of the one part of the brain, which is called the cerebellum. When it irritates that part of the brain, it results in cough. That's how this happens. Now, if you ask me what are the investigations done, all the investigation it is done to rule out secondary cause of cough. So if you can know the secondary cough, it is easy for us to treat the condition. But here, I'm going to mention only a few, the common ones, like after a complete physical examination, then we decide what are the investigation necessary and how long the patient has, what are the other related complaints he has. Depending on that, we decide on the investigations. Now the simple thing, the basic thing which is usually done after the complete examination, what you do is we need a chest x-ray, and if it is suspicious of something, we will go ahead and do a CT scan. And suppose the patient complains he has got cough, which is dry cough, but he gets severe headache. Just if he coughs 2-3 times, means his cough and the headache severity is totally different. So maybe he has got some brain related structural changes like aneurysm, or maybe he has got a brain malignancy also. So what happens is, when he coughs, because of these brain related changes, he gets severe headache. So these things are not common, it's very rare. So the common things first always. When you say this topic is mainly related to primary cough headache, where after investigation, we know that there is no known reason for the cough. So I am dealing with that now. So we need to do an MRI and MRV to rule out any brain related causes. Now coming to the main treatment part of primary cough related headache. Now, when you have cough, suppose you go to a pharmacy and you ask him, we want something to stop the cough. Whatever he has, suppose he has got a cough suppressant, or maybe he has got a cough expectorant, he will give it to you. He may ask you 1 or 2 questions only. But in a case of primary cough, what you need is a cough suppressant. You don't need a cough expectorant. So what is the difference between an expectorant and a suppressant? See, a expectorant means what happens, the windpipe or in the bronchus or the lungs, we have mucus secretion, which is 3 times thicker than water. So this gives us little coating to the windpipe and the lung tissues. So when this irritates the airway and we are not able to breathe properly, the patient used to cough. So in these conditions, we need an expectorant. So what the expectorant does is, it thins the thick mucus and it is expectorated out, it is brought out. That's how it acts. Here, what we are dealing with is primary cough headache, where there is no known reason. We have already ruled out all the reasons, and there is no thick mucus secretions also. So what you need is a suppressant and not an expectorant. Now you understand what is the difference between a suppressant and expectorant. So, and along with that, I will tell you few home remedies too. So that is the main thing. That is for the cough. And for the headache, I'll tell you what to do. If you can do steam inhalation at least once a day, please don't overdo it, at least once a day, that will be fine. So that will be good. So just plain hot water will be enough, or if you can add up 4-5 tulsi leaves, that is fine, herbal, or eucalyptus leaves 4 or 5 cleaned ones, or 4 or 5 drops of eucalyptus oil, or turmeric powder, or in the pharmacy you can get Carol Plus. You can add up half of it, that will be more than enough, or Cinarest. So Cinarest Plus, that also can help you. So at the same time, when you have cough, you may have throat irritation. So if you can do warm salt water gargle, that also can soothe them. So salt water gargle, how much salt to be added up? You have to for 1 glass of water, there is 350 ml of water, half teaspoon of rock salt or plain salt will be more than enough. And when you gargle, you have to gargle at least for 15 to 30 seconds, spit it out, and do not eat or drink for next 30 minutes. That is the proper way of doing it. Now, what are the other things which to be done? So the primary cough, we have to break the cycle of coughing. So each time when you feel you have to cough, instead of cough, what you do, you take a sip of warm water. So keep warm water in a flask nearby. So whenever you feel you need to cough, you're going to cough, try to take a sip of warm water and try to break that cycle. So when it stops after 4-5 times, when you do it 10-20 times, it slowly comes down and it stops by, the cough stops by itself. Once the cough stops, the headache also will be gone. And another thing which can be done at home is, if you can get original honey, forest honey, half teaspoon 2 times per week, that will be more than enough. And if you are in a habit of smoking, please stop smoking and try to avoid passive smoking too. And not only that, try to avoid any known inhaled allergens and avoid any cold drinks. And if you have a habit of sitting in the air condition, the setting should be at 24 or 25. It should not be very cold. Keep your hands clean, tidy always, and be on balanced diet. Try to avoid oily foods and junk foods. And another important thing is, try to avoid aspirin containing foods. The reason is, maybe you have some sort of allergy, and aspirin doesn't go along with allergy. It aggravates the allergy. So aspirin containing fruits, please try to Google and find out which are the aspirin containing fruits and try to avoid that, because when you take, even that can induce cough. And probiotic and zinc is very helpful. So this is all done for cough. So for the headache, you can prevent and you can treat. For prevention and the treatment, and when you have headache also, you can take indomethacin and propranolol. See, both these medications, you need a doctor's consultation first. Why? Because both these conditions we totally avoid if the patient has got bronchial asthma, he has got acidity, gastroesophageal reflux disease, likewise he has got any renal, kidney related diseases, we do not give these medications. So please try to avoid, I am talking about indomethacin, and please try to avoid taking or buying medication of your own without any consultation. So this is how we manage a case of primary cough headache. So I have given you one medication, that is cough suppressant, and so many home remedies. And for the headache, propranolol and indomethacin can act as a treatment as well as for prevention. And suppose it is secondary cough headache, unless you treat the secondary cause, the headache is not going to go off. So that is how we deal with a case of primary cough headache. Thank you so much.